Hello, good morning, everyone. Let's kick off the day for the second day of EGYPTAIR conference. We will start the day by the first panel for the AI-powered diagnostics and predictive analytics, machine learning in the disease management. I would love to welcome on the stage our moderator, engineering Laila Helmi, responsible for the Digital Innovation Director and Commercial IT at AstraZeneca. Welcome on board, Laila. I would love to welcome also Dr. Aya Yassin, Professor of Radiology, Ain Shams University, and the Executive Director of ASU Center of Excellence of AI in the Medical Sector. Welcome on board, Dr. Aya. I would love to invite also Dr. Ahmed Izzat, the Digital Healthcare Manager for Siemens. Welcome, Dr. Ahmed. I would love to welcome on board Dr. Sung Soo, Professor and Associate Chair of Institute of Global Health and Human Ecology. Welcome on board. Thank you so much. We'll start the discussion with the engineer Laila Helmi. Thank you so much.
Good morning, everyone. As Madonna thankfully introduced me, I'm Laila Helmi. I'm Director of Digital and IT Innovation at AstraZeneca Egypt and part of Egypt's senior leadership team. And I'm really happy to be here with the esteemed panel and also in EGYPTAIR because I have a very close connection to EGYPTAIR all my life. I've seen and I've been in the hospital and I've always seen that the hospital adopts innovation very fast and early on. So the topic of today is not different than what we're seeing every day and what we're using every day. So AI is a very big, important part of our lives right now. And people think it's new. However, it started ever back in the 50s. However, the train that happened or that fast track that happened since the 2000s with generative AI coming up 4 or 5 years back, as well as introduction to healthcare. Maybe healthcare is a bit early on and in the adoption of AI. So I'm very happy to discuss this today, and we're going to discuss 3 main topics on how to revolutionize diagnostics with AI, which is a very important topic, especially with the big population and the increase of patient numbers and the capacity of doctors in ratio with the patients. Technology has to serve them. And of course, AI and bridging the gap in research and what are the technologies available. And people think technologies may not be in Egypt. However, they are. And even in the hospital itself, there are very advanced technologies when it comes to AI. So we're going to discuss this and how also the hurdles of AI and how we can adopt fast and what are the things that we need to consider ethically in order to adopt. So I want to start quickly with Dr. Aya Yassin, the Professor of Radiology and Executive Director in Ain Shams Center of Excellence for AI. So, Dr. Aya, how do you think AI changed diagnostic precision and early detection in radiology? And what are the most promising results from your work at the Ain Shams Center of Excellence?
Morning. Thank you, Dr. Laila, so much for the invitation. I really am happy to be here among my colleagues in EGYPTAIR Hospital. Most of the colleagues here at Radiology Department, other departments are my colleagues at Ain Shams University, so I'm so happy to be here at this esteemed institution. And it's a pleasure to be again with you, Dr. Laila. It's really a pleasure. I first talk a little bit about our experience in Ain Shams University. We're proud to say that we are the first university in Egypt to adopt an organized structure to deal with AI in the medical sector. We founded a center of excellence in AI, and it works mainly on 3 pillars: on education of the staff, the doctors and the students about AI. The second thing is research, which we think is the strongest thing because we are academics and we don't work this alone. We do partnerships with the big players in the market and also with the startups to move from the academics to R&D phase, and then maybe we can be commercial. What I can say about increasing the diagnostic accuracy and the precision, I would just mention one thing. To make it clear that the human eye can see 8-bit in the grayscale, but the machine can see 16-bit. So that's why while we are diagnosing, we have to play with the window and so on. So with the shortage of radiologists, with the workload that is increasing day by day. 15 years ago, when I was a resident, we used to report like 5 CTs during our night shift. Now we have like more than 50 during one night shift. So we're tired, we're burnout, and the machine that can read and recognize 16-bit of grayscale in a fraction of a second is a great help. It can never replace us. It can never take our role, but it can help. It saves time. We have now on our work list that it prioritizes important findings, as in chest X-ray, the emergency cases as pneumothorax, as things that are life-threatening, hemorrhage in the brain, and so on. They come up first on the list, so we can see them. You have another application, mammography. We actually studied this in real life. We compared the performance of the algorithm to radiologists of different experiences. It's actually comparable to a very experienced doctor, but it's a little bit superior than a newly fresh graduate or something. So it's very helpful. Saves time, saves the energy of and the burnout of the physicians. I believe in the coming few years, it will be a great addition to our work. It will increase our accuracy of diagnosis, will speed up how we deal with patients. One other thing with the radiologists, we just had an upgrade to the machine where one of our machines where deep learning is reconstruction is involved. The MRI that has been really a tough experience for anyone who used to stay like 30 minutes inside the machine can do the exams in 8 to 12 minutes. And so we moved to the era of screening and early detection, which also improves the lifestyle and well-being of patients. So there are lots and lots of things to do with AI, and we're dealing with it every day. Of course, with our partners, that I'm proud that 2 of my partners are here. Thank you, and thank you for.
And maybe you tackled a very important topic that AI is now integrated. However, we're still facing a bit of issues when it comes to the adoption. So sometimes we face resistance from when it comes to doctors on it's not part of their curriculum and everything in their studies. And then suddenly we tell them you need to use AI. So what strategies have proven most effective in training radiologists and medical staff, especially in Ain Shams University, to integrate AI tools in their routine clinical flows?
Thank you, Laila, so much. This is a very important question that we actually faced this years ago when we started introducing the digital transformation and changing from paper to the HIS and the PACS system. We faced this resistance, so we're used to resistance. But I'll take an example as radiologists and, for example, pathologists, where we're starting digitalizing the department. We're used to technology. We adopt technology faster than other departments. So when just people learn how this helps them and makes their life easier, they can't get rid of it. We're taking it step by step. We're introducing it bit by bit, but people are seeing results that are really helpful and saves time. I think it's well embraced at our university, and it's getting more popular with all the departments. I get calls every day from every single department that they have those softwares they want to install, and they have this research they want to start with. So I think we're getting it well at Ain Shams University. Thank you.
Thank you so much. So we heard about how AI is enabled when it comes to radiology. However, a lot of people don't think that it is very close to us in Egypt, especially when it comes to the technologies that are existing now. So I'm going to move to Engineer Ahmed Izzat, Digital Healthcare Manager from Siemens. Can you walk us through a successful AI-enabled chronic disease management that Siemens actually has implemented and it's up and running, and what made it work?
Okay, Siemens have a lot of project about AI. One of it, the more famous, it's AI Rat Companion. Have an 8 modules based on how to two pillar. One of the accuracy, how to increase the accuracy of diagnosis and help doctor, okay, in time and in accurate result. This involves some of techniques and the algorithm. Okay, wants to come to need to data, okay, and need to radiologists and need to AI expert and engineering. Okay, this is the first channel. How to communicate between all these specialists and do some of cooperation and manage this project. This is the first challenge. The second one, okay, from where to collect the data. Siemens have a lot of partner clinic registers and the research centers, plus around the 5 worldwide. Okay, we have 2 billion point of data. Okay, collected in diverse nation. Okay. Now we have a stable module. We already implement one of it for the organ radiotherapy, one of the private hospital in Egypt. And I see, okay, this is not in academic research only, but in organ risk radiotherapy, we minimize the planning for the treatment from around 3 to 45 minutes to 5 minutes to plan to contouring the images from the CT and send to the treatment planner, okay? And I think this is why AI may be used to help in time, which is crucial for the chronic diseases, okay? And accuracy, okay? Before AI, a resist can say it's organ for risk 1, 2, 3, okay? And the contouring and send. With AI, we send all the organ at risk, not from the resist only point of view. Plus, we minimize the study, okay, time and high accuracy. Plus, we have a lot of diseases as cardiovascular diseases and lung diseases, plus neuro disordering for brain MR. Plus, we take our consideration very important, the security and the patient identification, okay? Because this is one of the risk when we said any doctor, you will use the AI. No, it's my data, it's my patient data. No, okay? But we approve now for all doctors, okay, how we secure and anonymous any identification for the patient. The last, how to implement, okay, this is a tool, okay, in the whole system, not as a separate island, okay, not integrated with HIS, the EMR, whatever, because doctor, when he said, you will use this and then use this, oh no, it's too much, okay. One of our challenge, and we solve it, how to integrate and not interrupt the workflow for doctor, okay? Because we come to solve a problem, not make a problem. Thank you.
I think we tackled also right now 2 times in the past minutes about the time. People think AI only helps with accuracy and early diagnostics and advanced tools. However, even the time element is very important, especially with a big population, where the more we save time, the more we can serve more patients. So I really like this angle was tackled more than once. So maybe my second question is, how do you see the future of AI-driven decision support evolving in Egypt, public versus private healthcare system?
Okay, I see a great opportunity, okay, for our population and for any vendor can provide AI or research, because we are one of the biggest population in the area, okay. Plus, we have a very medical infrastructure, very good medical infrastructure, and very unique radiologists and doctors. But we have some challenge in the infrastructure for IT. Okay, we have a challenge in the budget because the research in AI need more budget, dedicated budget. Okay, but I think in now with the direction of the whole country as a vision of 2030. Digital transformation will take a priority in the country, and we see some improvement and development in the infrastructure structure for the country at whole. In the public, I see if we can prove for the private, okay, how these tools generally, not AI specific, how to increase the accuracy of the diagnosis, how will increase the profitability of the healthcare entity. He will take a great chance in Egypt.
I believe you mentioned the digital strategy of Egypt once it was announced this year of integrating digital health clearly in it. I think this was a success for everyone interested in this field, that we actually saw it inside the strategy, which is once it's there, we can easily put it in the protocols. So I want to move to Dr. Sangsu, professor in the Institute of Global Health and Human Ecology and the American University in Cairo. So we talked about the problems and we talked about the solutions. However, when it comes to the bigger picture, population health, how did you see this now integrating, linking to the last question I asked Engineer Ahmed? How can AI-powered diagnostics feed into national big data strategies for better population health surveillance?
Thank you very much for nice questions and interesting me. If we recall, for my case, around 15 years ago, at the time, there was no clear tools to make a machine learning system. During that time, so we wanted to make a predictive model of the stroke of persons using the population data. That means that we had organized certain of the department, and then we gathered all the structured data from the communities, and we successfully make a predictive model. But that is a really long history of a long time ago. If we recall the innovation of the data science, around 10 years ago, we could successfully establish the health analytics aspects using many of the new technology. Before that, we used only the structural data and using the technique of the health analytics, the analysis. Then, since then, we implemented the health analytics techniques using a bunch of big data set. And then later on, we expanded our idea to the machine learning system. So when we applied the machine learning system, practically all the data science has been dramatically innovated. And then after that, probably 3 or 4 years ago, we could see the AI happened in here. So AI does have lots of abilities to support our population health regarding for example, we can predict our future pandemic using AI tool. It should be based on the machine learning system. That means that without having robust and reliable data, it's impossible to make wonderful AI tools, because AI is developed using the previous experience, previous data, and the collective input from the general population and experts, and also in the areas. So when we generally see our usage of the AI, we can easily make a sentence, and we can get the very simple answers and the complex answers. But if you see in detail, the solution is not clearly showing exactly what we want to have. That means that because of all the information was based on all the information from around the world. That means that probably experts can input their ideas, doctors can input, and then general population does have their own ideas. They put everything, then it goes to our solutions. So when you interpret the result of the AI, it's sometimes very delicate. That's why Indian University developed AI centers to clear up all the outcomes, very simple and to have accurate and validate. So for example, for the population, we can predict our future pandemics using Google Health data and Google, but sometimes it's very accurate. It's a very advanced one to using the unstructured data as well as the sensory data, so on. But sometimes when we go in detail, it's very hard to make accurate result using that one. That's why, so we can use the AI system in general, but we need to be careful to use the AI tools. For regarding your question, so using AI, not only measuring the future pandemic, but also we can make very good intervention programs to assess at-risk group, like as cancer group, diabetes group, and cardiovascular groups. So we can easily make a group, and then we can make a brief intervention programs to prevent their disease, which will be probably in the future. So also we can develop the campaign programs, like as a vaccination campaign programs. Sometimes vaccination is one of the essential tools to enhance population health itself. But if we do not do approach to the exact target group, it's probably we will lose the efficiency and the effectiveness too. So that's why using the AI tool, we can identify the targeting groups to develop campaign for the vaccine, as well as the prevention programs for the cancer patient, diabetes patients. So probably I just based on my research, there are so many tools were already developed regarding the healthcare management systems, and then also the other policy evaluation AI programs, so on. So we can see the very bright future using AI tool, but still we need to add some more intensive collective intelligence to shape this AI tool. Thank you.
So actually, you've answered already one of my questions I was going to add was that AI is very powerful. However, with the existence of the right data sets and the quality of data is very important. We always say it in IT, garbage in, garbage out. If the data itself is not annotated in the right way, or it's tagged in the right way, or even has all the metrics that we need, then the AI will not be as powerful as we think. So it's a very important point as well, especially with big data sets. So we talked about the positives of AI, and of course we know that it has a lot of benefits. But how do you see the ethical and policy consideration you foresee when integrating AI diagnostics at the public health level, which is a very critical topic?
Yes, that is one of the key challenge of the development of AI. Especially we are using the very sensitive data from the unstructured one, and sometimes the data comes from the very naive persons, like old age persons and the patient, as well as the children's child. So sometimes, when we distinguish about the project, research project, and the tasks from the government. In the cases, if we approve as it is as government tasks, we don't need to get the approval of the IRB approval, because government's routine activities is guaranteed to protect the privacy itself, because within the mechanisms they need to assure that their privacies. But if we conduct our own project and the collective project or the research project, we should get IRB approval. That's why sometimes we need to make strong mechanisms to protect the individual privacies, and then using not only for using the only name or address, but also we need to protect some of sensitive data set of the individuals. Basically, AI is the solution to solve the collective solutions. That's why I'm not worried about ethical issues a lot, but probably if we could make a wonderful framework to protect privacy and considering ethical aspects, probably can solve that issues very well.
So maybe I'm conscious of time as well because of the other panels, but I wanted to check a question. Maybe I will go from Dr. Song and back and close as well with Dr. Aya. I'm going to go outside of the prepared questions right now, but I want to check. So what are the one success story that you've heard that made you believe in the power of AI? So personally, for example, we were talking in the break that lung cancer, I've always known that it's a very hard disease. I studied it and I understood that people get diagnosed very late or they die without knowing it. So seeing an AI actually detect at stage 2 was the spark that made me interested in this field in particular. So if you will choose one example that once you've heard it, you believed in the power, especially when it comes to healthcare, and you'd like to see this implemented across the world.
Yes, that's very interesting questions and important questions. I have several good examples. If I say this program is the best one, then probably I'll have a certain of the conflict of interest. That's why if I say some of examples here, then like IBM's Watson Health, as well as the Health Catalyst and the SAS Health Analytics, Google Health, and then from the WHO, there is EOS programs to predict the future pandemics. There are several successful stories in our history, but if I suggest one single idea for the future, probably we heard about the One Health approach in health area. This is really, after we had a very huge pandemic of the COVID-19, all the global societies were concerned about the prediction of the future pandemics. So only One Health approach can predict exactly the timeline and the symptoms as well as the early detection. So probably all the One Health approach should have collaboration with Ministry of Health aspects and the pharmaceutical aspects, because we need to micro-disease aspects as well as the agriculture, environment, and animal health, including every single of the data from their sites. We can collectively develop very successful AI model, not only for the Egyptian, but also African countries, but as well as expanding the global health. In that cases, we can exactly predict our global future pandemic.
Yeah. So the main topic or the theme is pandemics and predictability of something that that's not existing right now, but with all the elements in place when it comes to data, not only the health elements, but the geographic and the environmental elements. Predictability of pandemics. This is one the key topic, the theme that you're interested in.
Exactly.
Right?
That's why you need to link every aspect of data
Exactly.
to use the AI tool. Then
interesting.
probably it will contribute to the human societies globally, as well as we can effectively prevent our future crisis.
So, Jimmy Ahmed.
Okay, I remember from 20 years ago, okay, when we go to any one of our professors in radiology, in public or in private healthcare, and said we will need to install a back system, picture archiving, okay, in the radiology department. And he said, what? You need to pay for a CD? No. I am already printing in film, and we can read, and all thing is fine. Now the picture archiving system, one of the infrastructure for any department, okay, no any new hospital or any private or public radiology center must have a back system for teleradiology. For that, I think AI is coming, will be one of the infrastructure in healthcare. But I see the opportunity here for our country to be good fit, okay, and good food for AI industry, okay, as we told. Plus, in my family, I live with my mother and my wife, cancer, okay, and I see how can the time, okay, increase his treatment plan, okay, this because we implement in organ risk, okay, and see the treatment plan, okay, decrease from 45 minutes to 5 minutes, okay. I am proud to be a part of this solution. Thank you.
Very inspirational. So, Dr. A, I'm sure you've seen a lot as well. So, what inspired you once you saw it? You saw this is something that you want to be an advocate for and streamline.
Yeah, thank you. That's a very interesting question, especially with we're here. At first, I want to congratulate EGYPTAIR for going live with their HIS. Oh, that's really big, and so they're moving to the next step into AI. The thing that really made me passionate about taking this path in my career is one thing that when I learned about the reconstruction of contrast images from non-contrast images. I used to see patients die on the imaging table from reactions to contrast media. People suffer from kidney injuries that last for life and they have to go undergo dialysis. Reconstructing those contrast images from non-contrast images is really a breakthrough and saves lots of lives of those patients. And it's really a thing that touches the everyday life of a radiologist, a technician, and a patient. I really am passionate to the innovations that really touch the patient's lives rather than those predictive with what you see on social media or whatever. I know these are the most prevalent, but I really I'm touched and passionate about things that really touch the human life. And I'll conclude by what was mentioned in the report of UNDP yesterday about the human development, that the human development has been slowed for the past 40 years, but AI is going to restore the normal human growth of human development. There hasn't been any breakthrough innovations in the past 40 years. Our generation didn't do any innovations, but it's coming with the AI. So we have lots.
That's very inspiring. And just to wrap up what we've came out with today. So in Egypt, we have very successful examples of actually driving AI in healthcare. Maybe years back, people didn't think that we will do it that quickly, but I see it every day in my work that even now, instead of us approaching people, telling them about the technology and its importance, now healthcare organizations like EGYPTAIR, Ain Shams, are now proactively actually seeking such solutions. And that's, for me, 10 years in AstraZeneca, I see a huge shift from what happened years back. And the second thing is the importance of predictability and population health, and the speed and not only about early diagnostics, machine learning, and actually analyzing data for healthcare outcomes, but as well as the time aspect, that we will save more lives in much little time with under-resourced, especially in underserved populations where the number of doctors are not matching the huge number of patients. So I hope you got good outcomes from today's sessions on the importance of AI. I'd love to thank our amazing speakers for your inputs and insights, and I myself learned a lot today. So thanks a lot, and if there's any questions, please let us know.